Are you looking for world-class health and wellness advice combined with a dose of inspiration and spiritual encouragement? You've come to the right place. This is nourishment for body and soul. This is Manna, and I'm Dr. Turner. Welcome.
This afternoon's conversation is really exciting. We're going to be talking about joint health. That includes everything from shoulders, knees, hips, lower backs, all those things. You know, statistically speaking, 80% of us are going to get some sort of lower back pain in our lifetime. And as a matter of fact, right now, by some estimates, about 65 million Americans are suffering from some type of joint-related health. It could be sports-related, it could be age, it could be anything in between. But with more and more younger people taking attention to things related to their joint health, it's becoming much more of a preventative discussion than just something later on in our life when we're suffering from arthritis or more serious ailments. So again, this afternoon, we've got joining us from Washington is Dr. Michael Turner, a Western doctor who you can find at michaelturner.com. Thank you for joining us. And we'll have a round robin this afternoon, going back and forth. Feel free to submit questions. Dr. Turner, who's joining us with the Western approach, do you want to talk about some of the causes, some of the things that you see, and then as well some of the common observations that are sometimes plain vanilla and perhaps more nuanced when you think about joint health, mobility, things of that nature?
Sure. Thank you. Glad to be here. And John, thanks for the invitation. It's good to do this again. When I think about arthritis and an approach to that, I first categorize, is there some type of autoimmune problem going on? Is there some systemic inflammatory process going on? This would be the case with, for example, your rheumatoid arthritis, your lupus, something along those lines. That can be detected by lab values, and those need to be addressed appropriately, very much in a certain vein of treatment that's different from your run-of-the-mill wear and tear osteoarthritis, so to speak. So I first have to triage into one of those two categories. Of course, thankfully, the osteoarthritis is the more typical category. This is what you would think of as grandma gets old and her knees start to hurt, right? And so that is more typically seen and more easily treated typically as well. The first thing that we need to realize as a potential cause for that would be injuries or repetitive stress to the joint. So let's talk about the example of the knees. When you run, there's a 3 to 4x body weight force load through your foot that reverberates up through the lower limb. So if you are a 150-pound person, right, you can do that math, 3 to 4x, let's call it 3x to be conservative, right? There we are. The force load is magnified compared to what you might think. And if you're running several miles a day and you have crummy footwear and you're running on concrete, something like that, you've got a significant load that's accumulating slowly through your joints. If you are jumping repetitively, let's ask the question, what's the force load go up in that case? Right? And they've done these studies biomechanically. If you jump off a box and land, they'll put sensors in your knee. How much force goes through your knee? The answer is 7 to 9 times body weight. Okay. Pretty striking. So this is the reason that all repetitive jumping athletes like volleyball players, basketball players, etc., are going to tend to get knee arthritis at some point in their career. It's going to slow them down. They're going to have typically a hastened experience of arthritis as they get a little bit older. More for regular people, it matters as far as some of the activities that you might be doing, wanting to switch them more towards low impact as you start to get a bit older, and certainly making sure you're having things like good footwear or running on treadmills versus hard surfaces or the softest surface that you can, that type of thing. There's only so many loads that knee is going to sustain over its lifetime. Another factor besides repetitive stress or specifically an injury would be misalignment. So misalignment. So in this case, you could think, what if you had a flat foot problem, right? What if your foot were turning inward? That's going to end up rotating your tibia, which is your shin bone, in a certain way. And that, of course, is then going to affect the biomechanics at your knee. So if you have a flat foot on one or both sides and it's not corrected, and again, just going through daily life or more accentuatedly doing an exercise program of some sort, walking 20,000 steps a day, et cetera, all of a sudden now you're going to end up with an abnormal wear pattern in some of the joints up the chain of command. Sometimes this also happens with a leg length discrepancy or, for example, even just tight muscles. You might just have tighter low back muscles on one side. Maybe you have a back injury or tight glute muscles. And again, it pulls your lower extremity kinetics a little bit out of alignment. The way I would describe it is like having a hitch in your giddy up, essentially. There's a little hitch in your giddy up, so you don't have that smooth pattern moving forward, and it results in some abnormal wear and tear. Another common reason would just be being overweight. Okay, so obesity obviously adds a whole bunch of extra weight to the joint, magnified under situations of impact as I just mentioned. And then there are some things that are a bit unavoidable, but that would be hereditary. So there are certain types of genetic mutations that will create weaker collagen, structurally speaking, than other people. So some people just have robust collagen structures, joint, bone structures, and they'll be durable into their 80s and 90s. Think of them like a Clydesdale, the farm horse type of genetics on that. And some people simply don't. Aging process, of course, as you get a little older, there's going to be a loss of cellular activity. There are chondrocytes, and those are the cells within the joints that stimulate production of new cartilage. And you tend to have a fall off of your chondrocyte number and activity as you age. And then finally, being postmenopausal. For example, in women, the estrogen levels promote healthy cartilage. So those would be some of the most typical causes that I see for the osteoarthritis, the wear and tear arthritis.
Dr. Turner, what are some of the best practices that you always go to? And then are there any nuances that you think are relevant as well?
Sure. Well, I would say let's begin with 7 ideas. I would say there's 7 core concepts from my viewpoint that would constitute comprehensive treatment for wear and tear osteoarthritis. So number 1 is some type of movement, some type of safe movement. Although movement might be painful, it's also necessary for your joints. So we want to find that pain-free, safe movement that everybody can perform. Because to do nothing is to get weaker and stiffer. So even my worst osteoarthritis knee patients, they might come in and say, Doc, I just really don't want to have a knee replacement. What can I do? I'll do anything possible, but I can't walk too far outside. I start to hurt. I've got to find for them that pain-free movement pattern that can work for them. It could be something as simple as sitting in the lazy boy with ankle weights on and lifting their leg back and forth. It could be some mat work where they lay on the floor and turn and twist and lift their pelvis off the bed, gentle Pilates, something like that. So some sort of movement has to be there because joints need movement actually to help promote circulation of synovial fluid and basic limberness, let's just say, of the ligaments, right, in the joint capsule. Number 2, there needs to be balance and symmetry within the movement. This is important. So we want a good movement pattern. Again, if you think of the concept of walking, someone says, okay, I'm going to get them my 10,000 steps, and I watch them walk down the corridor, I want to make sure that these 10,000 steps are within some balance and, frankly, aesthetic to some degree as they're moving, right? If they're limping and sideways in what they're doing, they're going to hasten their problem. So we want to correct any kind of balance or asymmetry. This is where adjustments become very helpful. So I work with chiropractors quite often. I'll say, you need to get your hip adjusted or your low back. You're out of alignment. Or specific muscle lengthening, deep tissue stretching techniques, again, working with a soft tissue expert. But let's say you have a hypertonic, aka chronically tense muscle in your glute or your hamstring or something because of prior injury. We need to loosen up certain muscles so that there's a symmetric neuromuscular pattern. So number 3, I talk about the idea of support. That joint needs support. Let's use the example of the knee. I tell people, your knee likes a strong leg. Okay, your knee likes strong leg muscles. The stronger your legs are, the more your knees like it because the more they're supported. Kind of stands to reason, right? If the muscles are weak and uncoordinated, then we have more collapse and shifting and sloppiness going on in your knee joint. So the first thing I say is we got to strengthen your legs. There's no such thing as getting your legs too strong. We're going to do it in a pain-free manner, but the stronger your legs, the more supported the knee joint. So very helpful there. And number 4, then, I would talk about precursors, the idea of precursors for the cartilage. So we can ask the question, what does cartilage need to be healthy? From a dietary viewpoint, for example, what do I need to consume in order to keep my cartilage at optimal levels of health? And this would be things like your glucosamine, your chondroitin, or your MSM in particular. Those are 3 heavy hitters for precursors for nourishment. Number 5 concept I talk about is reducing oxidative stress. Most people have heard of oxidative stress, and on the flip side, this is why antioxidants are helpful for us. I like to give a couple of vignettes just to bring that to mind so it's not so much of an abstract concept, right? So let's just ask the question, what is oxidation? What is oxidative stress? Rust, okay? That old junky car your neighbor has left outside for too long and the fender's rusting, that's oxidation, all right? It's a chemical reaction with oxygen in the air to break down the molecular structure of something, in this case, the metal, and it's actually destroying the 3-dimensional structure of what's there. Another example is cutting an apple and you leave it out in the kitchen and it turns brown. That's oxidative stress. Oxygen from the air reacting with the molecules there on the surface of the apple. So you can imagine you don't want much oxidative stress inside your body, therefore. That's picturesque. And to say we want to limit levels of oxidative stress in the knee, we don't want any kind of process like that hastening destruction of 3-dimensional structures within your knee. So on the side of reducing oxidative stress, we have the benefit of antioxidants. This would be things like vitamin C, vitamin E in particular have been studied with arthritis, or SAM-E. If you've heard of that, SAM-E, it's another antioxidant that's been studied for osteoarthritis. Number 6 would be reducing inflammation. Once the cartilage degeneration, destructive process gets going within the knee, as an example, there are high levels of inflammation, and we can take knee fluid out and we can study that and we can see what's going on there. The picture I use for patients is like old motor oil, right? So you've got a certain amount of circulating fluid in this knee, and as there's a damaging process going on, you start to get high levels of these inflammatory molecules, and frankly, we need to diminish those levels or take them out altogether. So sometimes to withdraw fluid from a patient's inflamed, degenerating joints is quite helpful. It'll kind of give a reset to some of the levels of inflammation within, as well as taking oral anti-inflammatories, my favorite being fish oil or any kind of omega-3 fatty acids, but also things like turmeric or certain kinds of enzymes are very helpful, digestive enzymes, bromelain, protease, things you may have heard of. There's a product I like called Wobenzyme. Specifically, it comes out of Germany, but it's a patented ratio of enzymes. It's very helpful for osteoarthritis inflammation. The final concept I mentioned would be stimulating healing, stimulating a regenerative process. So what if we could do an injection, for example, somewhere, let's say in that knee, and we would stimulate activity of the chondrocytes, we would stimulate new cartilage deposition, we would stimulate strengthening of the ligaments, tendons, etc. What if we could do that? And the answer is we can. At its most aggressive, this would be stem cell injections, right? But these are all types of regenerative injections. You have stem cells. Slightly less aggressive than that would be something called platelet injections or platelet-rich plasma, also known as PRP, if you guys have heard of that. And then slightly less aggressive than that would be something called prolotherapy, PROLO. And our listeners can look those things up. Quite helpful for stimulating some healing in any given area. So that would be the approach for me.
One question that popped up that I think is interesting is, can you talk about carpal tunnel and things like text thumbs? Yes, we will, because that's something that more and more people are suffering from, and certainly is one that's very, very timely. I know I suffer from it and whatnot.
Sure. Yeah, let's take a moment then. Let's talk about carpal tunnel and text thumb, certainly topics of interest far and wide amongst people we work with. So from the Western viewpoint, carpal tunnel we look at as a pressure problem. It's a pressure problem over the median nerve as it goes through into your wrist. So if you imagine my hand and then my wrist coming forward towards it, there's actually a three-dimensional tunnel if you look end on. And in that tunnel, you have many of the tendons coming from your forearm, a couple blood vessels, a couple main nerves, and one of them is your median nerve. So we understand carpal tunnel as a pressure problem on the median nerve. Now, why do we end up with pressure problems on the median nerve? Different reasons. So first of all, repetitive use of the hands. As I'm gripping forcefully, you can see there's tendons moving and snapping in here, and you can imagine that the pressure is increasing in my wrist. Absolutely. Some people have bigger or larger wrists. Again, that's genetics. Some people have thicker or thinner tendons. Same thing. Then there are certain situations like pregnancy where your whole body will swell and you're a little more prone to this phenomenon. So we have a pressure problem in the wrist. Therefore, the answer is how to reduce pressure over that nerve. The simplest way is through stretching. So I will tell people about a carpal tunnel stretch. It'll look something like this. You'll bring your hand back and your arm will extend straight, okay? And so you're holding this position for 10, 15, 20, 30 seconds perhaps, and that will slowly three-dimensionally begin to open up some space in your wrist. Second level up from that would be to wear wrist braces at night. People often have bad symptoms at night because their hands are folded up, right? They're sleeping like this for a prolonged period of time, and then they wake up and they wonder why their hands numb or tingling and end up shaking their hand. So a carpal tunnel brace, which essentially just keeps the wrist in a nice open position at night, can do wonders. If patients are having a lot of trouble also during the day, I would recommend likewise them using it a little bit more often. Final option comes down to an injection. So an injection can be extremely helpful for carpal tunnel. We do an injection of cortisone, essentially, which reduces the swelling of the nerve, reduces the irritability of the nerve, and can quite helpfully forestall even surgery. So sometimes people will get results from a carpal tunnel injection that lasts 9, 10 months, and they may say, hey, I'd rather just come in once a year and get a shot than have surgery. Worst case scenario, surgery is also very helpful. I'm not a big fan of surgeries. Obviously, it's a last resort, but for carpal tunnel, it's actually a very effective surgery. I would put it in the category of like appendicitis and getting your appendix out. So it can solve pretty routinely in a pretty safe and effective manner a very common and plaguing problem. For example, I had to tell my mom not too long ago, Mom, you really just need to go have carpal tunnel surgery. She did. Now she's back being a happy grandma, good use of her hands. So in the carpal tunnel surgery, what they do is they make a small incision here at the base of the wrist. And if you were to look on end on like this, they come through, they make a small incision, and then they just open up a little more space and just reattach the ligaments. Okay, so it's extremely simple. There's no hardware, there's no implantable screws, devices, nothing like that. It's an incision. It's basically like plastic surgery. It's a reshaping of that area that goes on. And typically, patients get dramatic relief from that. Let's talk about text thumb. So it's certainly a problem. It can represent really 3 different diagnoses from my viewpoint. So the first thing is we got to get really clear on exactly what's going on. So most typically, text thumb would refer to a tendonitis back here on this main tendon here on the side. It's a little bit perhaps hard to see on me, but it's this main tendon coming off the side of your thumb here. And this goes by the medical name de Quervain's Tenosynovitis. But this is basically an overuse phenomenon. You've got a tendon sliding back and forth inside of a sheath. And so it's a friction phenomenon. Sometimes there's little adhesions that occur, little micro tears, and we've got to try to reduce the stress and strain through this tendon and or stimulate some healing there. So that's de Quervain's Tenosynovitis. That's most typically what text thumb is. This will be helped through stretching some of the forearm muscles, through wearing a splint to just simply rest that area, as well as trying to modify a little bit your texting amount of time or size of phone, some things like that. Bottom line is, God made this tendon for a certain amount of movement, and we might be overusing and abusing it 10x the amount that it was ever intended to do. So we got to adjust our lifestyle a little bit. We can't expect all parts of our body to bear up under the strange wears and tears that we put them through. So there's a little bit of lifestyle adjustment ultimately for this problem that will go on. And there's some things you can do. You can rub things topically on there. You can ice that area, put Aspirin cream or something over the counter, try to reduce some of the inflammation and irritation. And worst case scenario, we do some cortisone injections in that area to try to reduce, again, the irritation, the inflammation around that tendon. So that's typical. But we have to look a little further, because sometimes text thumb would actually represent some arthritis of this thumb joint right in here. We call that CMC. It stands for carpal metacarpal arthritis. So this is called the first CMC joint, your thumb CMC joint. And this is a case where you can get some arthritis. So your thumb is sitting in there like this as it articulates with your wrist. And so this area can start to have some excess wear and tear. And the whole thing is surrounded by what we call a joint capsule. Think of it like saran wrap. So your thumb is sitting there and there's saran wrap around the whole deal. Well, this can slightly start to tug and get little tears in your joint capsule that surrounds the whole thing. Again, that's an overuse phenomenon. That's thumb arthritis in particular. The last thing that can happen is what we call trigger thumb. So trigger thumb would actually be on this area right here. Same concept. You have a tendon coming in called the FPL, flexor pollicis longus tendon. And again, there's a sheath, there's a groove, and if this tendon's overused, it starts to get hung up, irritated, and sometimes adhesions can form. The classic example of text thumb would be your finger locks in this position, okay, or trigger thumb more precisely, and you get a locking like this. And this can happen with any finger, so you may have heard of trigger finger of different kinds. But sometimes the text thumb problem is really what we call a trigger thumb problem, more aptly described. And so we sort those out and triage them appropriately where they need to go.
This wraps up another edition of Manna. I enjoyed our time together, and I hope that this has inspired you towards a healthy and happy life. Be blessed.